Hi, I am Dr. Chandra Shekhar, consultant shoulder and sports surgeon, Sunshine Hospitals, Hyderabad. I am going to speak on sports during this hot summer. A hot environment definitely causes some exhaustion in the body due to the vigorous sweating that accompanies hot environment. It's already summer and children are having their summer holidays, and a lot of kids are there out there playing on their own or during the summer camps. What happens when somebody plays in a hot environment, especially when there is humidity, there is a lot of sweating, and the person loses a lot of body water and electrolytes or the salts in the body, and this is called, in a milder form, what we call as heat exhaustion, and in a severe form it can cause heat stroke. The common symptoms, what happens is when somebody is playing in the hot sun, they may feel giddy, they may feel weak, and they may complain of headache also. So what you have to do when somebody is like this, please bring him into the place where there is some shade, or bring him into the indoor and give him some oral rehydration solution, especially that there is some carbohydrate, is still better. And if somebody is still severely ill, administer IV fluids or intravenous fluids. If the person is having no symptoms for 2 days, 3 days, is fine, and say for example his urine color is normal. Remember, when somebody loses a lot of water from the body, the urine turns dark. So if the urine color is normal and the person has no symptoms, he can get back to sporting activity in a matter of 2 to 3 days of time. But coming to heat stroke, which is the more serious variant, wherein an otherwise healthy individual who tends to do some vigorous exercise or high intensity sporting activity under hot sun can develop sudden increase in body heat, what we call as a core body temperature, and sometimes the temperature can go so high up to 104 degree Fahrenheit. And what happens in this scenario? There is a lot of sweating from the body, and the heart has to function excessively to pump blood to the exercising muscles and to the skin. And as a bargain, the blood supply from the vital organs like kidney, liver, and even from brain will be diverted to muscles and skin. And this creates some kind of toxic atmosphere inside the body, and this causes dysfunction of multiple organs in the body. And the person can complain of severe headache, and they can complain of severe weakness and nausea, and then they may, in severe cases, they may suddenly faint or collapse. So what somebody has to do in this scenario, bring him into a shady atmosphere, or bring him into a shade, or bring him into indoor, remove all his clothes, and if you touch him, you know that the skin is very hot, and start pouring cold water on the entire body, and till you keep pouring the cold water till the body temperature comes down at least 101 degree Fahrenheit, and keep some ice packs on the scalp, in the armpits or in the groins, and immediately arrange for a medical attention. So try to call for an ambulance or try to shift him to a medical facility nearby so that he can get emergency medical attention. Now once the medical treatment is over and the person recovers, it may take anywhere between 1 week to 1 month to get back to his sporting activity or exercise program. And of course, please mind and return to sport or exercise program in this kind of scenario is only after thorough medical evaluation, and only when the physician gives you, go ahead, then only you can go back to your sporting activity. Thank you.